So our last group presenting today is Dr. Singh and Dr. Vest from Pickery, really, but they have a new group that they're standing up um, on CTSI Dissemination and Implementation Science Core through the CTSI. Or actually, Bonnie, it's not new, is it? It's part of the original submission, isn't it? I guess I'll
Um,
wait for your presentation to learn more
yeah, it's new with this new
with
submission.
the
So
new one.
new as of
Okay.
January. Yeah. Yeah.
Okay. All right. Well, thank you. And I will pitch it over to you.
Yeah. Okay. So I'm Bonnie Vest. Dr. Singh is not able to join us today, but he's the director of the Dissemination and Implementation Science Core, and I'm the associate director of the core. And we are a new group within the CTSI, within the Clinical and Translational Science Institute. And so we wanted to take a few minutes to introduce ourselves and our focus, and the services that we are offering and will be developing and offering in the future. So just a little background in case folks aren't familiar with dissemination and implementation science in general. The goal of dissemination and implementation science is to study the process and outcomes of implementation in the real world. So really trying to narrow that translational gap between when we make a discovery of an effective medication or device or practice or other intervention, and that gap from when it actually becomes part of routine practice out in the real world. So we're looking at practices that are already evidence-based and then how they're adopted. And the goal is really to improve population health and partner with communities and practitioners outside of academic settings. To put it really simply, this is a quick slide from a paper from one of the leaders in this field who talks about how to sort of define this in very clear language. Whatever the thing is that you've developed, whether it's a medication or a device or a process or a screening tool, a diagnostic tool, whatever that is, we're traditionally used to thinking about effectiveness research, which is whether or not that thing works and does what we want it to do. What we do on the implementation side is look at, okay, we know the thing works. Let's assume we know the thing works. How can we help people use that thing or do that thing? And so we talk about implementation strategies, which are the things that we do as implementation scientists to help people adopt this new thing and do it. And instead of measuring how effective the thing is at changing health outcomes, we're really looking at how well are people using it and how much are they using it, and are they actually doing what we intended for them to do with this innovation. So that little background in mind about what implementation science is. We are a new core within the CTSI who are helping to build capacity at the university for researchers to do more of this more research at this end of the translational spectrum. So in the real world implementation space. And so we're going to be offering several different things as part of that. One, we're going to have some consultations. We'll be doing workshops and developing some toolkits, and then having this database of potential partnerships for researchers looking for partners in the community. So for the consultations, we have a form already available on the CTSI website, and there'll be a QR code at the end of this that you could scan, where you can request to consult with a member of our team if you think that your project may have some implementation components to it. And we can provide guidance on a wide range of topics related to dissemination and implementation science, like study design, the use of various models, theories, and frameworks that have been developed around D&I science, metrics and evaluation. We can help support the development of grant proposals in this space, as well as thinking about disseminating results and connecting with community partners. So those are sort of individual one-on-one consultations. You can reach out to us and we can meet with you, learn about your project, and go from there in terms of thinking about how we can best support the work that you're doing. We will also be, they're not online or not available yet, but we are working on developing several toolkits as well using an interactive AI platform that will help us curate the vast amount of resources and literature around some of these topic areas so that people can easily sort of interact with the material and identify the pieces that will be most helpful for their work. And we will also be developing a workshop series as part of the CTSI's workshop series that they offer. So we'll be having some workshops on, more in depth about introduction to D&I science, getting into frameworks and models and study designs that are commonly used in implementation science. And then finally, we are in the process of curating a database to help researchers identify real world partners and help with that connection to the community. And so this will be a living list of community organizations and partners so that when a researcher is interested in moving their study into that next phase in real world practice, we can help identify community partners and clinic sites and other groups that may need to be at the table to help bring that project out into the community. So if you want to learn more, you can contact Ranjit or myself. And then either of these QR codes will take you to our page on the CTSI website generally, or to the consultation form I mentioned specifically. So I think that's it. Thank you.
Thank you, Dr. Vast. And if you don't mind, could you send me your presentation? We're going to be sending out some emails requesting them
Yes.
later
Yep.
today. You could,
Sure.
that would be perfect. So, and congratulations on the renewal.